Hey there, deep divers. So you're curious about cannabis use during pregnancy. With legalization becoming more and more common, it's a hot topic, but trying to figure out what can feel like, well, wading through a swamp of info.
That's where we come in.
Exactly. And for this deep dive, we've got a whole stack of research to unpack. We're talking studies from JAMA, pharmacology and therapeutics. We even found some personal stories from moms. Medical journals, reviews, you name it.
Yeah, we're going deep on this one. No jargon, we promise. Just the straight facts on what the science really says. And trust me, there are some surprises in here.
Oh, I bet. Okay, so first things first. Cannabis use during pregnancy is definitely going up, especially among younger women and those facing tougher economic situations.
Yeah, that's right. There were a couple of studies actually back in 2018 and 2019 by Corsi and his team that really highlight this trend. And that makes understanding the potential impact even more important.
Makes sense. Now we know that THC, the part of cannabis that gets you high, you can reach the baby through the placenta.
It does.
So how much does that actually affect the baby? Like, is it a big deal?
Well, that is the million-dollar question, isn't it?
It is.
There was a review in 2018 by Grant and his colleagues. They published it in Pharmacology and Therapeutics, and they pointed out that even though THC crosses over, the fetus usually gets a lower dose than the mom. But as far as those long-term effects, well, that's what we're still trying to figure out.
Gotcha. So that kind of brings us to the next big question. What about the baby's health once they're born?
Right.
I mean, a lot of people worry about things like lower birth weight, maybe the baby being born prematurely.
Definitely. And some research has shown a possible link there. Corsi's team, actually the same group we talked about earlier, they had a paper in JAMA in 2019. They found a potential connection between cannabis use and those outcomes.
Okay.
But there's a catch. Many of those studies rely on moms self-reporting their cannabis use.
Meaning they could be downplaying how much they're actually using?
Exactly. And it's tricky to separate the effects of cannabis from other things. Like, what if they're also smoking tobacco, which often happens?
Right. So it's all tangled up.
It is, like trying to untangle a really messy knot.
So how do we make sense of all this? I mean, with all this back and forth, what are we supposed to believe?
Well, that's where looking at the totality of the evidence is so important.
Okay, what's that mean exactly?
It means we don't freak out over a single study. Instead, we look at the bigger picture, all the research, all the data.
So we don't get caught up in clickbait headlines.
Exactly. We consider the quality of all the research, how consistent the findings are, that sort of thing.
Okay, that makes sense. So let's get to the brain development stuff. I feel like that's a huge one for people, especially concerns about autism.
Absolutely. And this is where some really interesting and honestly reassuring findings have come out recently. There have been a couple of large studies, both published in JAMA Network Open, that dove into this. The first one was from this year by Young Wolf and their team. They followed kids up to 5.5 years old. And guess what? They found absolutely no link between cannabis use during early pregnancy and developmental delays.
No link at all. That seems kind of huge.
It is big. And then there's another study from 2023 by Fine and his team, also found no connection between cannabis use during pregnancy and autism.
Wow. It's like these studies are saying, hold on, maybe we need to take a step back and rethink some things.
That's exactly it. These newer studies, they're larger and better designed than a lot of the older research, and that helps us get a clearer picture of what's really going on.
So when it comes to research, size does matter.
Absolutely. Larger studies are better at controlling for those messy knots we talked about, all those other factors that could be skewing the results.
Makes sense. Now, I remember reading this study from Jamaica. It was a while back, 1994, by Dreyer and colleagues. And get this, the babies exposed to cannabis actually did better on certain developmental tests. Seems completely backwards.
Yeah, that one definitely raised some eyebrows.
I bet. So does this mean cannabis is suddenly the secret to smarter babies?
No. Definitely not saying that. But it does highlight how complex this research can be. In Jamaica, cannabis use is more culturally accepted, so separating its effects from other social and cultural factors, well, it's tricky.
So context is super important.
Oh, hugely important. And it's a good reminder that just because two things happen together doesn't mean one causes the other. There could be a whole bunch of other things influencing the outcome.
Right. So we've covered a lot of ground already. Cannabis use is increasing. THC can reach the baby, but those long-term effects are still unclear. We've got studies suggesting some risks, others saying there's no link to developmental problems, and then there's that head-scratcher from Jamaica.
Exactly. And there's still more to unpack.
Well, let's keep going then.
Now let's talk breastfeeding. We know THC can get into breast milk. Grant's 2018 review, that was a big one for this.
So does that mean moms who use cannabis just can't breastfeed?
Well, not necessarily. It is something to think about, though. How much THC actually gets into the milk, that can vary. Depends on how much cannabis the mom is using, how often she's breastfeeding, things like that. We need more research on those long-term effects for babies. There was a review back in 2015, though, Metz and Stickrath, is in the American Journal of Obstetrics and Gynecology, and they said there might be some effects, like sleepiness, maybe some impact on motor development, even growth.
Okay. So more to learn there for sure. But what about moms who use cannabis to manage their own health issues? I mean, some women might rely on it to help with anxiety or deal with chronic pain, even nausea during pregnancy.
That's a really important point. We can't forget about the mom's well-being in all of this.
Right. Like, what if not using cannabis could actually be worse for the mom? And then indirectly, that could end up affecting the baby too, right?
It's tough. There's no easy answer. That's why it's so important for women to talk openly with their doctors. If they can work together, weigh those potential benefits and risks, maybe they can find a plan that feels right for everyone involved.
So finding that balance is key.
Exactly. It's about giving women the information they need to make informed choices, choices that work for their situation.
Speaking of informed choices, something we kept seeing in our research was how some moms feel like they're getting mixed messages from their doctors about cannabis. There was this study in 2020, Barbosa-Leiker and their team. They interviewed a bunch of women in Washington state, and a lot of them felt lost. Like their healthcare providers weren't all on the same page about cannabis use. They felt confused, unsupported.
That's got to be so frustrating. It's already hard enough to figure all this stuff out, and then to have the people you're supposed to trust giving you different advice. Ugh.
Exactly. Makes you wonder how much of the stigma around cannabis use keeps women from talking openly with their doctors.
Mm.
Like, what if they're afraid to be honest because they're worried about judgment or even, being reported to the authorities?
Oh, absolutely. That fear is a huge barrier to getting good information and support.
It is. So where does all of this leave us? Sounds like we need a more honest, open conversation about cannabis use during pregnancy and breastfeeding. One that doesn't shy away from the tough questions, acknowledges all the layers involved.
Totally agree. We need to move away from just say no and towards something more, I don't know, nuanced, a more compassionate model, one that focuses on harm reduction and support.
So instead of just saying don't use it, we meet women where they are. We listen. We give them the information they need so they can make the best choices for themselves and their families.
Exactly. And we can't forget about those bigger issues that influence a woman's choices in the first place. Things like poverty, not having access to good health care, that fear of legal consequences.
Because let's be real, just telling someone to stop using something without understanding why they're using it, that doesn't actually solve the problem. It's like putting a Band-Aid on a broken bone.
Perfect analogy. We need to go deeper. Create a system that really, truly supports women.
Okay, so let's say we've got two listeners tuning in right now. One is very cautious about cannabis use during pregnancy. The other is more open to it. Maybe they even use it to manage a health condition. What would you say to each of them?
To the listener who's feeling cautious, I'd say this. The most recent research, those large-scale studies we talked about, from Kaiser Permanente and the SEED program, they haven't found strong evidence that cannabis used during pregnancy causes lasting harm to kids' development, at least not when it comes to things like cognitive delays or autism. So the risks might not be as big as we once thought.
That's got to be somewhat reassuring for someone who's feeling all those what-ifs. But you're not saying there's zero risk, right?
Right. We still have a lot to learn, and that's where personal choice comes in. If someone is really concerned about any potential risks, even small ones, then choosing not to use cannabis during pregnancy is absolutely valid.
Makes sense. What about our listener who's more open to using cannabis? Maybe they find it helps manage their own health challenges.
For them, I'd say informed decision-making is everything. Talk to your doctor. Find one who understands cannabis and pregnancy. Weigh those potential benefits and risks. And remember, the research is ongoing. We're learning more every day.
And even if you do choose to use cannabis, moderation is key. Grant's 2018 review, remember that one?
Yeah.
It showed that how much and how often you use can affect how much THC gets into your system and your baby's system.
Right. And if possible, skip smoking or vaping. That brings in other harmful stuff. Edibles or tinctures might be a safer way to go.
Good point. And what about timing? Is there a better time to use cannabis during pregnancy? Or maybe a worse time?
That's a good question. And honestly, the research isn't quite clear yet on that. Some studies have suggested that using cannabis in the first trimester, when the baby's brain is developing so rapidly, could be riskier.
So maybe if you can, delay using cannabis until later.
That could be a good strategy. But again, talk to your doctor. They can help you figure out the best approach based on your situation.
So it's really not one size fits all, is it? Every woman's pregnancy is different, and there's no magic answer for what's right.
Exactly. And we can't forget about the mom's well-being in all of this. It's not just about the baby.
Okay, so we've talked about prenatal use, but what about when it comes to breastfeeding? We know THC can get into breast milk, but we don't have a lot of solid answers on those long-term effects for babies. What are your thoughts on that?
To be honest, the research on breastfeeding and cannabis, well, it's even less conclusive than the stuff on prenatal exposure. There are hints of possible effects, but we need more definitive
It
answers.
sounds like we're back in that murky gray area again.
We are, and it's got to be tough for moms who are just trying to make the best choices for how to feed their babies. What we do know is that the levels of THC in breast milk are generally lower than what's in the mom's blood, and it peaks about an hour after she uses.
So timing those breastfeeding sessions might help, like minimize how much the baby is exposed to.
Could help, yeah. And just like with pregnancy, avoiding smoking or vaping is probably the safest route.
Okay, so for breastfeeding moms who do use cannabis, what's the bottom line? What should they keep in mind?
Talk to your pediatrician. Be honest. Weigh those potential benefits of breastfeeding against any risks from the cannabis exposure. And remember, there are resources out there. The Academy of Breastfeeding Medicine, for example, they have some good guidelines on substance use and breastfeeding.
Good to know.
And trust your gut. Don't underestimate that mama intuition. You know your baby best.
You know, we focused a lot on potential risks of cannabis, but something I keep thinking about is this. What about the risks of not using it? Like, what if a woman depends on it to manage a serious health issue, and stopping could actually be harmful to her?
That is such a critical point, and it's so often overlooked. It's not just about the baby, it's about the mom, too. We can't forget that. Often, what's good for the mom ends up being good for the baby as well.
Right. It's about finding that balance, making sure both mom and baby are being taken care of.
And that's where personalized care comes in. Working with the woman to come up with a plan that feels right for her, considering all her needs.
So less judgment, more compassion, more individualized care.
Exactly. And more research. We need studies that look at the whole picture, the potential risks and benefits. And that includes how cannabis affects the mom's mental and physical health.
Okay, that makes sense. Now, I want to switch gears for a minute. There was this study. It wasn't about cannabis directly, but I think it has some really relevant insights for us. It was in Health in Place back in 2019 by Brown and their colleagues. They look at healthcare experiences and birth outcomes of Aboriginal women in South Australia.
Oh, yes. I remember that one. It really showed the impact of something we haven't really touched on much yet. Perceived discrimination.
Exactly. The researchers found that Aboriginal women who felt they'd experienced discrimination during their pregnancy and birth, they were more likely to have babies with lower birth weight, or babies who were small for how far along they were in the pregnancy.
Powerful reminder that the environment around a pregnancy matters. The social and emotional stuff, it can be just as important as any substance use.
Like, stress and discrimination can leave their own mark on the baby.
It's true. Makes you wonder if some of those negative outcomes we've seen linked to cannabis, maybe it's not really the cannabis itself. Maybe it's more about the stress and stigma that comes along with using it.
Whoa, that's a really interesting thought. So it's not just about what a woman is putting into her body, it's about how she's being treated, how she's feeling throughout her pregnancy.
Exactly. And it all comes back to creating a supportive environment for pregnant women, all of them, regardless of the choices they make.
Now, I want to circle back to something we talked about earlier, how the science on prenatal cannabis use is constantly changing. We've seen how those newer studies, the bigger ones, they've kind of challenged those earlier findings, painted a less scary picture, you know?
It's a great example of how science works. It's all about learning and refining our understanding.
But with all this change, it can get confusing for people who are just trying to figure it all out. So how do we keep up with those changing scientific understandings and still give clear, practical advice to women? You know, women who are pregnant, breastfeeding, trying to make these decisions.
That's where evidence-based practice comes in. Staying up to date on the research, absolutely, but also realizing that science is rarely black and white, especially with something as complicated as human development. There's always some uncertainty.
So we've got to be comfortable with that uncertainty
Yeah.
and incorporate it into our decision-making.
Exactly. Be open about what we know, what we don't know, and what the research can and can't tell us.
So in the end, it's about giving women the power to make informed choices based on the best information we have, considering their values, their own sense of what feels risky.
Right. And creating a space where those choices are respected, whatever they may be.
Okay, I think we're getting to the heart of what makes this whole topic so challenging. It's bigger than just the science. It's about social stuff, cultural stuff, even ethics. It's all tangled together.
And recognizing that each woman's experience with pregnancy and motherhood is unique. There's no single right answer. It comes down to individualization, compassion, respect.
I love that. Those are some amazing guiding principles for us as we keep learning about this and as we continue to evolve our understanding of this really complex issue.
They are. And they lead us perfectly into our final thoughts. And a little something for our listeners to ponder as we wrap up.
Wow, we've really covered a lot today. From how cannabis use is on the rise to what the studies actually say
Yeah.
about, the risks and the benefits. It's complicated.
It really is. Definitely more nuanced than a lot of the headlines make it seem. Not a simple yes or no answer.
Exactly. Which I guess can be frustrating, but it's also just where the science is right now.
Absolutely.
So as we wrap up this deep dive, I want to leave our listeners with something to really think about.
Oh, I like that.
What if the key to helping women make good choices isn't about more studies? What if it's about changing the whole conversation?
I love that.
Shifting away from all that fear and judgment.
Exactly. Imagine if we approach this whole topic, cannabis use during pregnancy and breastfeeding, with the same kind of open, honest, supportive attitude that we bring to other health decisions.
So instead of that knee-jerk, don't do it, we focus on meeting women where they are. We talk about harm reduction.
Right. Because let's be real, telling someone to just stop without even trying to understand why they're using cannabis, that's not going to be very effective.
Yeah, that makes sense.
We can't forget about all those systemic factors either. Poverty, access to healthcare, fear of legal problems.
Right, like we were talking about before. It's about creating a system that actually supports women, not just tells them what they can and can't do.
100%. A system that empowers women, gives them the information, the resources, the support they need, non-judgmental support, so they can make those choices, the ones that feel right for them and their families.
So it's a call for a more compassionate approach to prenatal care, one that recognizes that each woman's experience is different, her needs are different.
That's it. And it's a challenge to all of us, not just doctors and nurses, but society as a whole, to create that kind of environment.
Well said. That's a powerful thought to leave our listeners with. Thanks for diving deep with us today, everyone. Remember, knowledge is power. Keep learning, keep questioning, and let's keep advocating for a more informed, more compassionate world.